I'm Dr. DeAun Nelson, a naturopathic physician practicing in Portland, Oregon. I invite medical professionals to listen as I discuss how shifting the focus off of weight in healthcare can greatly improve health outcomes for patients of all sizes. I will explore what it means to practice in a weight-inclusive paradigm and discuss tools to implement these ideas in practice. Keep in mind that the information I will present may be new to many of my listeners and may sound radical to some, but stick with me. This information could change the lives of your patients. I had an amazing opportunity in May to talk with Deb Burgard, who is a psychologist who has been a very large part of the fat acceptance movement since the 80s and has just really been, I think, in my opinion, a backbone for a lot of the newer fat acceptance folks, and has been with the fat acceptance movement for so long. And she is an amazing person to talk to, and I'm so excited to have gotten to talk to her. The interview is actually a little long, so I'm not going to spend much time on the intro today. So let me tell you a little bit about Deb first. Deb Burgard, PhD, FAED, is a psychologist and activist from the San Francisco Bay Area, specializing in concerns about body image, eating, weight stigma, and relationships. She is also one of the founders of the Health at Every Size model, the original bodypositive.com website, and the Show Me the Data listserv, building communities where people can find each other and the resources to resist weight stigma, especially in medical and psychological treatment. Her activism includes working with healthcare providers to integrate an understanding of the social determinants of health and creating interventions that address structural oppression and support stigma resistance. She can be found at conferences sparking impromptu dance parties in the pool. I hope you all enjoy my interview with Deb Burgard. We definitely talk about medical stuff, but we also talk about a wide range of things that I think you will all find very interesting. Without further ado, here's the interview. Hey everybody, this is Dr. Nelson again. I am here with Deb Burgard, and we are about to start. Deb is a psychologist and eating disorder specialist, and I'm super excited to have her here. I've had the opportunity to work with her a few times, and she's definitely helped me in getting a lot of my stuff out where, I can go and talk to providers. And so I really appreciate that a lot. So welcome to the podcast, Deb.
Thank you so much. I'm so delighted to be here.
I'm so excited to have you. Let's just start out at the beginning. So if you could give us just your own version of what brought you into psychology, what brought you into Health at Every Size and the fat acceptance movement, because you have done so much stuff, so much stuff.
I know. I'm really, it's so weird because I used to be the youngest person, in the collection of people around the table. So I was in college in the late 70s, and the second wave women's movement was just sort of really intense and exciting and problematic and kind of everything all at once, and just learned a lot, and it was pretty thrilling. And I think coming out of that, it was kind of apparent to me, just even at my size, that this was sort of a big issue that really wasn't getting integrated with other progressive politics. Mm-hmm. And even in feminist politics, it wasn't very legitimated. It was kind of as a concern. It wasn't really, it was just, there were plenty of feminists who were, uncritically trying to get thinner, and, it just sort of didn't really get evaluated much at all. But there were some early activists who were doing that work in the 70s, from Southern California, from the Bay Area, from New York, who I ended up meeting much later, and who were doing this really incredible work. And it really started from the very beginning. It acknowledged the incredibly important role of the health discourse in the oppression of fat people. And even then, those activists were going to medical libraries, which was what we had before the internet, and they were looking up articles. And even then, because, this scientific community was even talking about how diets didn't work in 1959.
Yeah, I remember hearing about that study, and I was like, wait.
Yeah.
What?
So we've known that this is really true for decades and decades and decades and decades. And so they were looking at this research in medical libraries and saying, why are people asking us to do this when they know it doesn't work? They were saying that in the 70s. They were the foremothers. And of course, they were building on other activism movements and other incredibly important developments in the 20th century, like the civil rights movement, the very early queer movement, gay and lesbian was called at that point because we had too little imagination about
right.
What that was. And, even before that, the labor movements, all the 20th century was an amazing time in a lot of ways because a lot of people who were, living with a lot of oppression made some progress. So anyway, I always try to kind of, make it clear that, even though I've been at this for a long time, I just stepped into the football game, like it was well underway,
As most of us do. And of
right?
course, at the beginning we think, I've figured out this whole new thing. And then,
yeah. Right. So the ball was being moved down the field, well before my time. But I ended up coming back out to the West Coast to graduate school, and I wanted to teach a dance class for fat women. No, I was finding one other exercise class at the time that was in San Francisco. And that's an amazing thing too. Like there was already a fitness class for fat women here.
Nice.
And the woman who taught us was Eliza Mimsky, and her class was called Fat and Fit. And I ended up substituting for her at a later date and meeting the person who would go on to be my co-author, Pat Lyons, in the book that we wrote for fat women, in 1988, so called Great Shape. But anyway, I started teaching my class in Oakland and Berkeley, and did that for a few years until I had to stop to write my dissertation because I was like, I really got to clear the decks so that I can, get this thing birthed. And but I did it for 6 or 7 years, and it was incredible. I basically just was trying to make a space, and I advertised it for women over 200 pounds. And I knew there was a sort of, compromise about saying that because, I wasn't literally, going to weigh anybody before they come to the class, but I really wanted people to get it. Like, this is a class that's going to be paced for these bodies, not those bodies, and it really, the physics of doing a class like that, they are different. You don't need to be hanging from the chandeliers to get your heart rate going, and it's like, so we were able to do a lot more like what would eventually become, hip hop, more just sort of, smoother dances, that didn't have to necessarily be jumping off the ground so much all the time.
Yeah.
And in the whole party atmosphere of the class was just amazing. And so many of those people who were my students ended up going on and becoming activists, fat activists as well, or they were already involved in some way. So the class was a little community, an early on community that was a little nexus of activity, and just fabulous. So I was getting this experience that is really hard for people to get, which is I'm in a room with a bunch of laughing, happy, hooting and hollering fat women you know, who are just kind of like, you know, recharging their batteries together, you know, and really, you know, playing and, you know, it was, there's the health in that room, you know, no matter what the functioning level of each individual person was, there's just this sort of community health, right? Like there's just this energy that's such a healing energy, right?
It really is.
And so, you know, I was bathing in that like multiple times a week. And then I was also in graduate school and I was learning how to do eating disorder treatment, partly by my job, which was I would cross the Bay Bridge and drive to Redwood City, and I would go through the doors of this hospital and hear all these people, you know, inpatient for their eating disorder treatment, for their mood disorders, for their chemical dependency, for their trauma histories, you know, and this contrast, you know, between these spaces was so dramatic. And of course, the body size of most of the people who were in the hospital was very, very, very thin, because those are the people who get hospitalized most easily, right?
Yeah.
And so here I am seeing these people who are, you know, very thin, and the people in the world think they're so healthy, and they're suffering to the point of sometimes a couple of those people died, you know, and you know, we're just trying to blow on the little embers of the little coal, you know, inside of them of like, come on now, I know I can see you in there. I'm gonna like, come on, I believe in you. You can do this. You know, we're gonna help you give your body a chance to recover here. You know, we're gonna help you do this. But just sort of how far gone, you know, a lot of folks in that situation were, you know, there was just no way to maintain this fiction that everybody gets taught, and, you know, all of us have gotten taught, which is, you know, that there's a way to look at somebody's body and tell how healthy they are, you know? And so that just was forever broken in my mind. And I think it's because, you know, most people only see the people who are not coming for help with their health who are thin, and the people who are coming for help with their health who are fat, you know, and the people who are fat who come to a doctor's office have often been really trying not to come to a doctor's office, right? You know, because it's such an oppressive experience usually. So, you know, it just, the sort of notion of the confirmation bias was sort of, you know, really becoming clear to me. And so anyway, I'm sort of sitting there in that situation in the 80s, and I'm running into all these fat activists, and we're having this whole discussion, and I'm looking, and I'm also talking to healthcare providers, right? Since I'm learning how to be one.
Right.
And we started meeting. We actually started to have meetings in the Bay Area, because it was very clear to me that I wasn't going to put anybody on a fucking diet. You know, like I'm like, I'm not even going to start doing that. So I would have to stop. I'm never going to do that. Because I had basically decided for myself when I was in college as a feminist, essentially, you know, I had basically looked at my own fairly brief history with that, which was pretty much from the time my mom took me to Weight Watchers when I was 13 to the moment when I was sort of coming back from a summer of eating tuna and laying out in the sun. Just dissociate from my body, you know. And I sort of back in my body, the fall of my sophomore year, I remember I was walking along and I was kind of like, what am I doing?
Wow.
I was just kind of like, why am I doing this to my body? What is this for exactly? And I was like, because I was already in 2 different relationships. I was trying to figure out what I needed to do about, you know, kind of, there's sort of an abundance of relationships. There's an abundance of, you know, opportunity. I'm in this incredible place, you know, learning all this stuff. I just felt like it just became clear to me that there were ways of being powerful in the world that were available to me, and that I was never going to find that pathway through changing my body. In fact, it was harming me to do that. And it was like, fuck no. You know, so that was that. That was 19.
That is such amazing self-awareness at that age. I mean,
well, it was a lot of privilege, you know, like honestly, you know, you think about me being able to kind of go, well, I have got this other way of being powerful, you know, like, and it was really true. I mean, I happened to be very, very lucky that way. And even my childhood, I had incredible luck with how my parents really listened to me and really were interested in me, and they had their difficulties for sure. They had their things that were hard for them, but you know, alongside of that, they just gave me a pretty strong, you know, kind of, I mean, to the point where I was challenging adults, you know, like I would challenge adults fairly regularly, you know, like I remember my 4th grade teacher hated me because I was such a little know-it-all. So I still am. But anyway, I was a bossy girl, you know?
Yeah.
And so I think as a bossy girl, I kind of already experienced this privilege of having my power come from things that weren't about my appearance. And I was not going to give that up. You know, it was sort of like when I hit puberty and people were telling me you have to sit by the phone and wait for a boy to call you. Mm-hmm. That was a big, like, that was like the start of my adolescent crisis, you know, because I was like, oh, wait, excuse me, what? I'm going to have to do what? Excuse me, what? Why is this script flipping all of a sudden?
Right.
So I was thinking about this critically for a really long time. So anyway, when I sort of found a bunch of people out here in the Bay Area who were already thinking about this, and they were dietitians, they were physicians, they were nurses, they were fitness people, they were artists, performers, activists, you know, we were all kind of finding each other, and we were, and the healthcare people were basically saying, either I don't want to learn how to do this because it's bankrupt, or they were saying, I've been doing it and it doesn't work. And it's clear to me that it doesn't work. So what are we going to do instead?
Doing the dieting, you mean?
Yeah.
Okay. Just want to make sure.
Yeah. Thank you. Yeah. Prescribing dieting. And, you know, that's one of the reasons I have so much respect for people who were trained in this traditional paradigm, who really came to this realization and had the courage to say, you know, this isn't good for people. I mean, this is really, I'm paying attention to what happens to my people, you know, and it's not good. And those people had a lot bigger task in front of them, I think, than I did in a way, you know?
Yeah.
So we were all sitting around the table having these meetings, you know, and we started talking about, and, you know, I was already doing eating disorder treatment, and I was already, you know, very clear about, you know, intuitive eating and using, you know, a kind of trust in your body and all the body image issues that I was, you know, already working with, and I was already contributing to, you know, in these places that I was contributing exercises, I was contributing experiential stuff, I was contributing theoretical models of, you know, kind of how to think about this. And I still think the body image stuff the things that we think about as body image stuff is just ridiculously simple and wrong and trivial. And, you know, like, this is the thing that, you know, body image is a relationship, I think. And, you know, thinking about it that way is so much more powerful and opens up all these ideas. So, so anyway, I was already kind of starting on my own path around that. And I was looking in my dissertation at how fat women really thought about the whole prescription of weight loss. And my sample kind of separated into, you know, people who were sort of thinking about things conventionally and people who were thinking about rejecting the weight loss prescription. And it was so fascinating because this was all, none of these people were, you know, clinical people. They were not being diagnosed with anything at all. They were doing fine under all these measures. But the people who had rejected dieting were thriving compared to the other group. And of course, it's a correlational study. So I'm sure that the truth about all of this is that they had some sort of privilege / strength to begin with to do that. And they were, you know, also not re-injuring them, their sense of efficacy over and over and over again by trying to do something that's not really that possible. So we began, you know, kind of saying, what should we call this thing? And, you know, and people were like, health at every, I had been using health at any size. They said, no, we like health at every size. And they only use health at every size. I remember this big conference call that we were all kind of, you know, what do we should call it? I was never totally enthusiastic about health at every size. I mean, it just, you know, and it's been so misinterpreted.
It really has, yeah.
It's kind of like, it should have been health for all sizes, or health access, or health support, or like, you know, we really were not quite there in getting how healthism was going to bite us in the ass with this stuff. And we should have been able to sort of critique that more, but in the beginning we were really just busily sort of defending against the stereotypes, you know. But anyway, and then a little bit later, the mid-90s, I started thinking about body positive as a phrase, and I trademarked it to be so that Weight Watchers wouldn't use it. And started my little website that's still up there, like an ancient, creaky, you know, early, you know, little book written in Gothic letters or something, you know. But, you know, a lot of the things that I've thought about are there on that website. It's really interesting. But so HAES and body positivity and all that kind of stuff was just kind of, you know, I mean, the concepts were not coming from me, but, you know, but we were sort of there trying to kind of pull this together into something that would have, you know, some kind of reality for people, and to see what has happened since then is kind of amazing. But I wanted to also, you know, kind of give people listening a little context, because in the 90s, so the 80s and the 90s, there were a lot of critiques of dieting that were beginning to become popular. And I don't think people who weren't alive then, you know, kind of know this history.
I didn't. You mentioned it earlier and I had no clue.
Yeah. So in 1992 or 1992, I think, the National Institutes of Health actually had, you know, a statement that talked about how you shouldn't go on any kind of diet, even a medically supervised diet, unless there were 5 years of follow-up of all the people who were enrolled. And they basically said this doesn't exist. And that is an extraordinary moment that I don't think people even know existed. Like I linked to them, you know, eventually.
Seriously, like this is the first time I'm hearing about it, and I read all this stuff all the time. So
yeah,
if I were a tea kettle, I would be boiling at this point.
Yeah, and so Nutrisystem was going bankrupt. There was a book called Dieter's Dilemma that was very popular, and it was Joel Bennett, Gurin was the other author, and they were, I think, a Harvard scientist and a journalist, if I'm not mistaken, and they basically put all of the diet failure stuff together in one book. And so it was a bestseller, and people were like, oh, this is why, all this has, been my experience, this is why. So people were beginning to get hip to all of this stuff. And the industry was really freaking out. And so by the end of the 90s, they had regrouped, and they were coming together as industry, with strategies for what to do going into the next century. And they were also looking at this increase from like 1980 to the year 2000. There was, for US adults, there was an average weight gain of, there was a gain in the average weight, let me put it that way, somewhere around 15 pounds or so. Mm-hmm. There was also a gain in the average height of a half an inch. And, these are things that are interesting for sure, because, when you're talking about that big of a group of people, to change the average, is something's happening there. But of course, in a weight stigmatizing context, it was a bad thing that people were gaining weight, and and the whole height thing sort of was unremarked. Nobody even noticed that, right? And so the industry, I think, was beginning to kind of get its marching orders together about, here's what we're going to do. We're going to go, this is a crisis. This is an epidemic, quote unquote. This is something that's just going to go on and on and on. Kind of like all the eating disorder ideas that are sort of there in the culture, like that you can't trust your body and your body's not regulating, and, here we're going to have utter disaster because of this. And the other thing that happened was 9/11, in 2001. And when that happened, I remember thinking to myself as an eating disorder specialist, because when the world gets scarier, people go on a diet. They try to organize their anxiety into this weight loss thing, and it just seemed like, it seemed like a perfect storm. Like there were just so many reasons that people would find this more attractive again. And there was this whole public campaign where they took essentially the same data set, and they would just release a story about every single separate state, and the obesity levels in every single separate state, like day after day after day. It just sounded like, this overwhelming change. And it really wasn't an overwhelming change. I don't think most people even get it, that it was really a 15-pound average thing, Yeah. And, and there's some great theories about what that could have been about, or what that was about, and how it, then obviously it's slowed down since then. And sometimes, it depends on the population that you're talking about, but our bodies are not going to endlessly, our bodies were responding to something in the environment, right? And they responded, and then they're done.
Right. And maybe it was something that if we didn't have that average weight gain, it would have really screwed us over.
That's right.
I mean, we don't know.
Right, because
it's really important.
That's right. And right, there's really a lot that people find hard to think about with all of this too. Like, the deaths from cardiovascular disease went down. That, is partly because of people smoking less. It's also because people were getting hypertension. They were getting their hypertension treated better, and
they lowered the threshold too.
Yeah. So there's a good and bad about all that stuff. Like the big pharma is always going to try to, kind of change the finish line, so they can make bigger markets, and so sometimes that's really stupid and awful and creates a lot of needless suffering, and sometimes that gets needed treatment to people earlier, and hypertension, it looks like maybe is one of those things that, well, it's probably not a bad thing to get treatment, at an earlier point. But, it does seem also like, treating the whole thing about the cutoffs for diabetes is a big debate too, because like, are you really taking people who are going to develop diabetes, and getting to them earlier when you talk about pre-diabetes and you talk about lowering the threshold for diabetes so much. And, a lot of those people are never going to develop it, and then they're just scared to death, and, what they're supposed to do is so stupid too, that, they're learning a lot of diet stuff that they have to unlearn later,
but stop eating a whole macronutrient group.
Yeah.
Enjoy.
Yeah. So anyway, I mean, it's just been quite a ride. And, I think it's fascinating for me that people have just, responded so much to the idea that there could be a different way to think about all of this stuff. And that, and of course, the thing that I hope is that there's a way to use the sort of, relentless finding that social support is like, social support and resources and the social determinants of health are, just incredibly impactful. And still we're talking about these, these things that people can do. And,
this tiny slice of the pie. It's so relatively small.
Yeah. And, I work with people on an individual level too. So I get that, that people want to think about what's under their control to do. Mm-hmm. But to me, the reason for that is that you take back your relationship with your body, that you kind of you get to defend your relationship with your body from all of this stupid shit that we've been taught all along. And, we blame our bodies when people are mean to us, we blame our bodies. Like, if I wasn't fat, this wouldn't happen. Or if I wasn't hitting puberty so soon, these people wouldn't be so weird to me. And if I was, blah, 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 blah. And it's what we do, but you have to repair that. It's a childlike way of thinking. And, once the world has nothing to do with you, it's like you can defend your body and you can defend your right to a relationship with your body and the wisdom that resides in your body, in being able to navigate your life. And it's priceless. I don't know how to be a feminist without my body,
Agreed. Something that always comes back to me though is, I think it's so important to be able to have that internal connection to your body, and not assuming that, things that are happening to your body from other people are your fault, because that's very important to realize. But then also acknowledging that those things are still happening to you, and often because of something about your body, right? Like,
well, actually,
because a fat body or a female body or a non-white body or a transgender body, right? That even if you are like, I know that it's not about me, that's super helpful, except it's still happening. So that's where you get like the big push for, and I this, and you're going to probably talk about it, but the big push for removing the stigma and changing society in such a way that those things happen less. We're humans. I imagine it's not going to go away entirely, but less.
Yeah, even instruments that are designed to measure racism or weight stigma or some kind of external thing, they have items on them like, because of my weight, people treat me badly. Because of my race, people don't trust me or whatever, and I think even there's a problem. It's not because of your race and it's not because of your weight. It's because of racism.
Mm-hmm. Mm-hmm.
It's because of weight stigma. And even those specialists in studying this external thing, they keep locating it in the person's body.
Right.
And I find that really frustrating. And I think what you're saying is absolutely right, that it's happening to me. Like, this isn't about the denying of that harm and that reality. It's about the stance that you take, like, towards your own body. Is it to defend your body, or is it to blame your body?
Right.
And to me, that's really important. Like,
it is,
because it's internalized beliefs about your body being wrong.
Yeah.
And so most of us, you know, as kids and even a lot of adults, we believe that the world's, if something bad's that's happening to us, if it's happening to us, it must be because we're bad.
Right.
And so, you know, part of healing, I think, is to really get a theory of why bad things are happening, you know, that makes sense to you.
Right.
That is not you taking responsibility for somebody else's evil.
Right. What is it? Reagan Chastain says, it's not my fault, but it is my problem.
Exactly.
You know, so it's like, it's not because of who I am or how I look is not the problem. Or it's not my fault how somebody else is reacting to me. I do have to deal with it because it is happening.
Yeah.
I can't just, well, I mean, you can try to ignore it, but it's still gonna happen. Like, you can't stop somebody ahead of time.
Right.
But then being able, like you said, to have that internal resilience to say, okay, so, you know, that person who just shouted, hey, you're fat, when you're walking along the street. I mean, if you can take that to the point where you're like, yes, you know, I'm also tall. What is, not sure what you're trying to say here. And
I know, like, one of my favorite things to say is, like, you're saying that like it's a bad thing.
Right.
Help me understand? Like, what?
Exactly.
I mean, that's essentially what my dad told me to do when I was getting teased on the playground when I was a kid. And people were saying fatty, fatty, fatty. And I was kind of like, what? You know? And I went to him and I was like, what? I don't know what to do. And he just sat, he thought about it. He was sort of like, well, he said, what would happen if you agreed with him? And I was like, I don't want to agree with him.
Bad thing.
You know, like, what? And he said, well, hear me out. He said, he's like, you know, I think they're not going to know what to do if you agree with them.
Uh-huh.
And I think that'll feel kind of good. And, you know, you can see what happens. You know, he was just like, see what happens. And I did. I tried it.
And everybody was like, what?
And people were like, well, first they were like, fatty, fatty, fatty. And I'm like, yeah, uh-huh. And they're like, fatty, 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 you know. And I was like, I know. What?
This conversation?
Like, you know, and they were like, oh my God, you're so weird. And I'm like, I know. And what I understand now is I was a powerful kid. Actually.
Yeah.
And they were trying to figure out how to stop me. That's what they were trying to figure out.
Yeah.
And it was like, and they could, for temporarily they did, you know?
Mm-hmm.
So
I'm just starting to figure that out at like 45. So, you know.
Yeah. Well, the other thing that's really amazing is that if you're an eating disorder specialist and you sit across from people day after day after day, and they tell you the truth about what they feel about themselves, people who look like they walked out of, you know, the middle of a magazine, you know, like people who look like they're on the red carpet someplace and they're telling you how they actually feel. When people express weight stigma now, I don't think of them as a kind of, you know, judgmental committee that's above me.
Mm-hmm.
like, you know, like the cheerleaders in junior high or something. Like, I don't think of them that way, because I think of them as my patients, you know, like I think of them trying to heal. And I think of the suffering that they must be feeling, you know, if they think that way. You know, like if they're trying to get to me with this, it means that they're walking around internally themselves, you know, without a lot of room in there, you know.
Wow.
And you know, of course there are exceptions to that. There are people who are just nasty and, you know, evil and you know, but most people who are trying to hurt other people, that's not normal, you know, like that's not a state of mind that, you know, is admirable, or, you know, giving direction to other people, or, you know, just, you know what I mean? It's just, it doesn't make sense. And so I wish I could give that to everybody. I wish I could just sort of, you know, hear the result of listening to all this suffering.
Yeah, I see. I mean, when I have weight stigma come at me, or my patients, I see a lot of fear.
Yeah.
That I know is unfounded, you know, and I mean, that's why I do this podcast. That's why I try to talk to docs. That's, you know, that's why I do the work that I do, is because I want people to step aside from that fear, even if it's just for, you know, a few patients where they can just stop and go, okay, I'm not going to worry about it. Like, even if it scares me that I'm not telling this person to lose weight, I'm actually just not going to worry about it for a while and see what happens. Talk about it. I'm not going to think about it. I'm just going to see what happens if I just treat them for what they're here for.
Mm-hmm.
And in my experience, they feel better and they do better, and weight becomes less of an issue. I mean, it's still an issue in that they're living in a world that's fat phobic.
Yes. But
having a place like my office to come to, or their therapist's office to go to, where they can say, you know, wow, you know, this week was really big, really hard, and I had to deal with all this stuff, and just to have somebody go, that's rough, and you're doing such a great job.
Yes.
You know, that, you know, gives them a little bit of help to go out there. And I've said this over and over in the podcast, and I'll say it forever, that if physicians, if nurses, PAs, MAs, everybody who's therapists, everybody who's a part of the medical world, just created a little bit of an island of safety for their patients, where they just didn't have to worry, and they knew that they were going to get access to good care, which is a really big topic in and of itself.
Yeah.
Maybe we should do the second episode on access. You know, just have that opportunity to take care of themselves in a way that doesn't make them feel bad.
Mm-hmm.
I mean, it can do so much good.
It's so true.
I see it from my patients, and they only get to see me, you know, a few times a year maybe, or, well, some of them more often, but, you know, and yeah, I can see
the power of that relationship. I mean, this is what we were trying to ask ourselves around that table back in the 80s, you know, sort of like, if we're not going to do the weight loss prescription, what do we already know is really going to support people in their well-being? And we just looked at everything that we already had evidence for, you know, and we made it part of this, you know, sort of like, oh, well, you know, the big thing is social determinants of health, you know, like there's, you know, whatever you can do to figure out how to get barriers out of the way for people, and how to make, you know, connections with other people, with other communities, with, you know, social support, people having their backs, you know, other people having the same experience so they can find each other, you know, all the things that we know already, that really come down to relationships, you know. And what's really so scary to me about the industrialization of medical care, you know, is how people are, you know, it's really trying, it's an attempt to kind of remove the relationships from the equation. And to me, this is like the stupidest thing you could do. I mean, there's really so much magic in those relationships, and probably what we think of as the placebo effect, you know, is another word for the power of, you know, the sort of holding that we feel in each other's hands, you know, when we have these relationships, and the faith that we hold for each other's well-being, the faith in our bodies, the faith in healing, the faith in, you know, things can get better, you know, and we're going to care about each other, and we're going to try to make that happen together.
Yeah.
Like the latest conference that I went to with other eating disorder specialists, I was asking people to really reflect on, because I see this so much in this profession, you know, I just like, is your gift that you're trying to give to the world to classify everybody, you know, and then sort of try to norm them into, you know, nudge them into the norms, you know, where they're supposed to be? Or is your job, is your gift that you're trying to give to think about, you know, all these different people in all these different positions and all these different bodies, and how do we support them? You know, how do we support them? Because to me, that I'm trying to do that. I am not interested in so much of the things that are part of my profession.
Yeah.
I am not interested in, you know, the ways that people have sliced up, you know, diagnostic categories and things like that they're just so biased to begin with. You know, it's like, stop spending so much time on this, you know, this is not the point, right? And so it's a hard thing, because we're not going in that direction. We're not going in the direction of support the relationship, because, you know, these connections that people have with each other, you know, are going to really be the thing that helps them be okay.
Yeah.
Even though that's public health, you know, it's like the most robust finding in all of public health, right? It's like we keep ignoring it. Like there's something about this individual setting that just makes it too hard for us to think about, you know, how do we make use of that information, you know, and that wisdom.
Right. And what you were saying about the placebo effect being like connection and support and comfort with each other, it makes me think of the nocebo effect, and how
yes,
what we're doing medically now in the profession is actually that, like, that's disconnecting and, you know, not allowing for time when you only have, you know, at best 10-15 minutes with a doctor, maybe less.
Well, I've actually talked about this even more specifically, that this is when doctors say, you may be healthy now, fat person, but you're not gonna da 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 da. But this to me is a curse. It's a curse. It's like a literal curse. Like you are predicting doom.
Mm-hmm.
And it's a very different thing when it arrives in that kind of framework to tell somebody, you know, blah, 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 blah. Then you could even say, if you get your blood sugars into this range, then only, you know, it's going to mean that your risk of having some major complication goes down this much. Like, that's a really concrete thing to say. Right? And it's not a curse.
Right.
It's just saying, here's what we know about this path, you know? So this is why I'm trying to tell you about this path, because it looks promising, you know, and this is why.
That's something what I've started talking to because I have a lot of patients who come in if they haven't been to the doctor for a while, and they're concerned. They're like, I don't know what's happening with my body. And there are so many different reasons why people don't go to the doctor, not just because of their body size, certainly.
Yeah.
Because I have patients of all sizes who don't go to doctors. But, you know, they'll come in, they're very anxious because they're like, I'm afraid that I have something horrible.
Mm-hmm.
Or they've been told in the past, like, you're going to get this if you know, don't change. And then they don't change. So they're like, I probably have it, whatever it is. And I always tell them, I said, well, we don't know if you have it. So, you know, let's do some lab work. We'll just see what's going on with you. And you may not, but if you do, that's okay. We will address it and we will do our best to manage it, because everybody's body has different things that they have to manage through the course of their lives, you know, like.
That's awesome.
And I hope it helps. I think it helps.
No, it completely speaks back to the sort of neoliberal culture that we're all swimming around in, you know, which is basically, you know, like you're not a good biocitizen if you have something going on, you know, and, you know, to sort of go, yeah, a lot of people have things going on. A lot of us do. And so we're going to.
None of us get out of life.
Right.
Especially if you live long enough.
Yes.
Get out of life without acute issues, for sure. Like,
well,
nobody.
That's the thing about, you know.
Something. And then if you live long enough, most of us don't get out of life without some sort of chronic issue.
Yeah.
You know, and the few of us who do, I mean, bless them, they're super lucky and definitely outliers. Just like somebody who has to deal with something from the time they're born until the time they die they're also kind of outliers.
Right.
But you know,
this is the thing about, you know, we have fewer people dying of heart attacks in their 40s and 50s, right? Like you have less cardiovascular disease, which means that a whole bunch of fat people who would have died 40 years ago are not dying.
Right.
That means we're going to have higher rates of diabetes eventually. We're going to have higher rates of, you know, the things that people get in their later years. We're going to have higher rates of those things because people didn't die.
Yeah.
And so, you know, like that's a good thing, you know, like you can be glad about.
I like to tell people with diabetes, I always say that Laura Ingalls Wilder, you know, the author of Little House on the Prairie, she died from complications of type 2 diabetes. And people are like, what? I mean, she was like, you know, a settler and farmer and, you know, all the things that we are just like, that's amazing. And when I found that out, I was like, okay. And she was fairly old, but, you know, but that is something that happens. And, you know, she was like the, you know, the past ideal kind of a thing that people always want to go back to. Wow. You know, and I'm like, I don't know, we were dying pretty early a lot of the time, and a lot of things were problematic. So is now so bad? I don't think so.
Yeah.
And of course, I'm coming from the naturopathic world where everything has to be optimal and perfect. And if you do everything just right, nothing will happen. But let me tell you how many naturopaths I know who have had cancer. Nothing wrong with that. I mean, like, there's nothing wrong with that. I'm just saying, like, even trying to do everything perfect doesn't mean that you're exempt from getting things like cancer or diabetes or heart disease. Like,
well, I think we have to think about how all of this stuff is entwined with white supremacy, right? It's kind of like the whole aspirational goal, you know, is a moving target, and it's a Calvinist idea, you know, that if you're lucky, you're worthy, you know?
Right.
And that's another thing, that's another reason to read Sabrina String's new book, Fearing the Black Body, you know, the racist origins of fat phobia. I mean, she's really pulling together these ideas that are so powerful about the aspiration to a kind of body hierarchy, and how it messes with our relationships with each other. It messes with our relationship with ourselves and our bodies. And, you know, so, you know, the ableism in that idea that you're never going to get a disease, the, you know, healthism, the perfectionism, you know, the framing of, you know, somebody's privilege that makes them lucky is something that is an expression or evidence of their worthiness, you know. It's bullshit.
Agreed. It is bullshit. It is bullshit. And if we would treat each other as worthy all of the time, just because we're human beings.
That's right.
It would make such a difference.
But you are making a difference. I
am. I'm doing my little bit. You're doing your little bit. There's so many of us out there. I mean, I feel so fortunate to be part of such an amazing community that, you know, more and more I'm hearing like our ideas coming back from people I did not expect them to come back from. And
I know it ricochets around the world, and then
it really
there
does.
you are.
And then everybody's like, well, duh, hasn't this always been the case? And it's like, no, it hasn't. And
I cannot tell you how funny it is to be like sitting there on Facebook and somebody who's like 20 years old in Australia is arguing with me about what the health at every size model is and how she read Linda Bacon's book. And, you know, like, you can't be doing it if you're not intuitively eating. And I'm like, no. You know, and I'm sitting there thinking,
do you know who I am?
I don't want to be an asshole, you know, like.
You can think it. You can think it.
But it's an amazing thing. I mean, I had somebody 10 years ago, I had somebody come into my office who was visiting the United States, you know, for a work assignment with her family. And she had been in college in the UK, and she was coming in to, you know, do a little work and around another piece of her therapy. And, you know, I was asking her about things that had helped in the past and things that, you know, were not so helpful. And, you know, did she have any other questions about what she wanted from me or anything? And she just said, actually, the only thing that I'm kind of hoping that you've heard of is this thing called health at every size. And I'm like,
you're like, a little bit. I know a little bit.
Like, I just thought, this is like throwing a letter in a bottle out into the ocean and like finding it come back to you. Like, this is so trippy. It was just such a lovely thing.
That's amazing.
Mm-hmm.
That's amazing. Well, we've been talking for about an hour, which is usually about the length of my interviews. I suspect that if you are up for it, we can do another episode and talk about something else. I know, like, I had asked you, I do want to ask you, like, one thing, if you can distill it down. If you can't, that's fine. We'll just make a whole new episode about it. But I want to know what you want medical practitioners to know kind of the most about, like,
yes,
health at every size or raise stigma or working with patients. I don't know, whatever you feel like.
Well, you know, I've been so pleased that I've been asked to do some grand rounds for people in a couple different places, and I feel so like when I walk into those spaces, the place I always want to start is to really join with my audience here and kind of have us all think about, you know, how we as healthcare providers are walking around as if we're walking around in the daylight, you know, like, yeah, I know what I know, and I can see everything, and, you know, I can see that, I can see it. And when you really think about the state of our knowledge, it's more like we're walking around like under the Milky Way on a dark night.
Mm-hmm.
And I have a slide of the Milky Way, and it's kind of like, I think, you know, there's a lot of information about that particular thing. There's a lot of information about that particular thing, you know, but really the vastness of what we don't know, I just want to start there, because I feel like doctors have to perform knowingness.
Mm-hmm.
And they don't get information about this. They don't get information about this. And then I say to the audience, I want you to think about, you know, how many of you feel totally on top of the weight stuff with your patients? You just have it down. You know, people come into you, you know what to do, you figure it out, everybody's happy. 5 years later, they're still happy. You're all good. You know, everything's fine, no problems at all. And nobody raises their hand.
Yep.
And then I say, how many people in the room feel like in your training, you were told everything you need to know about dealing with fat bodies and higher weight people and what the problems are and how you deal with it and where the gear is, mm-hmm. and, you know, what the procedures are? How many of you feel just, I'm on top of that? No hands. And then I say, how many of you dissected a fat cadaver? And then that's where people are really looking around the room. And there's just nobody. I said, it's because we can't donate our bodies to science.
Yeah.
And they're just sitting there with their mouths open by then. And it's kind of like, that's where I want us to start.
Yeah.
I want us to start with it being safe enough to say,
I don't know.
I don't know how to think about this yet.
Mm-hmm.
And I want, and I think it's fine for us to be able to say that. And I think it's fine for us to be able to acknowledge that we've been wrong in the things that we've been doing for 60 years. We knew we were doing it wrong 60 years ago, and we didn't stop doing it. And it's like Thomas Kuhn and the structure of scientific revolutions, right? It's like this whole idea that, you know, science does not proceed by this little incremental change model. It's like people just keep doing what they're doing until there's an alternative, right?
Mm-hmm.
And so the Hayes model is like a first stab at, you know, what if we changed it to a process model?
Mm-hmm.
You know, what if we thought of the relationship that we have with our patients as being this thing that we're going to join together here, and we're going to have faith that, you know, in general terms, if you give your body an opportunity to thrive, you know, it will do its job, right? Like that bodies are really good at that. And that really the problems that we have to solve are how to give your body that opportunity, because there's stuff that's in the way.
Yeah.
There's external stuff in the way. There's internal stuff in the way. How do we give your body the opportunity to thrive? And your psyche, because that's part of health as well, of course. And those ideas about how we would do that for all the different kinds of bodies, as opposed to, you know, it's kind of like we all have to resist the role that we are being asked to play. The role that we're being asked to play increasingly is like we're quality assurance or quality control officers on a fucking assembly line, and the bodies are coming down the assembly line, and we're saying stamp of approval, throw that out, stamp of approvals, throw that out. You know, that's not what people went to med school for. That's not what we joined this profession for, and we have to resist this, and we have to actually do the calling. You know, and the calling is about joining people and about relating to people and about, again, trying to solve a very different problem, which is, you know, how to give your body the opportunity.
Mm-hmm.
I think that, and the other thing is that if people don't have a chance to know fat people, that is a problem.
Yeah.
Because you know, they're just exposed to a few people coming in who are desperate, you know, that's going to be a very different picture of what's possible. And I think about how if you can only imagine a fat life as, you know, desperation, the things that you are willing to do to, you know, that person to change their fat body include death.
Yeah.
Include everything, including death. And that is the harm of weight stigma and the lack of imagination about, God, you know, people have all kinds of different lives as fat people, like just the same thing that you would see with anything else, you know?
Right.
And so if you don't have, you know, access, you know, to a bunch of thriving fat people, you know, and communities of fat people, and kind of the awareness of what this looks like, and how people, you know, people from stigmatized groups are geniuses a lot of the time.
Yeah.
You know?
Yeah.
There's a lot of wisdom already here, you know, and, you know, that whole notion that you can learn from that community, let the community teach you then. We need a set of best practices for the care of higher weight people.
Yeah.
And we need it to come in a collaboration with our communities. And that is a long-term goal of mine, is to sort of say, you know, I don't want to be walking around in the dark forever. I want to build something, you know, let's build something, but let's not build it in the edifice of white supremacy. Let's build it from the communities telling us here's what we already know.
Yeah. I just read a book called Utopia for Realists. And one of the things that he talked about, this is sort of tangentially related, was the universal basic income and the idea of just giving poor people money, no strings attached. There's nothing that they have to do for it. There's nothing they have to spend it on. Just give it to them, because what they discovered when they do these little experiments is that when you just give people money, it doesn't even have to be a lot. It ends up, first of all, it ends up costing less. Because they actually will spend it on things that they really need, and the results of what happened are way outstrip the amount of money that is given. Like that, he had an example of 13 homeless men in the city of London. So they just hung out in that small area all the time, and I mean, they'd been arrested and taken to shelters, and had social workers, and I mean, all this stuff, right? It cost the city a lot of money, and then they decided to start just giving them money. Basically, they said, "What do you need?" And here's money to go get it. And in the end, I think it ended up being, I want to say, like $3,000 a year per person, and they were like almost all of them ended up finding places to live and finding work, and basically really changing their lives on their own. Like they weren't told to do this. There's just, here's some money for you. Here's like $300 for you every month. Like what are you gonna just go do something with it? And I feel like that is the case with things like this too. It's like, going to communities, what do you need? I mean, if you go to the FACT community, what do you need in healthcare? If you go to
there's not just one FACT community, right? Like
exactly all these different all these different and needs, and realizing that they're not a monolith. And then when you have sort of the basics for a general group, right? But then recognizing that each individual person is still going to have potentially different needs than whatever groups they identify with as a monolith, and then addressing it, and saying, hey, okay, who are you?
Yeah.
What do I know about you?
Yeah, it's wonderful.
Yeah. Well, I have really enjoyed talking to you. Thank you all for joining us today. The theme music was composed and performed by Galen Davis. Cover art was designed by Stacy Bias. If you enjoyed the podcast or learned something new, please subscribe, as it helps amplify this important message. Also, please feel free to share with friends and colleagues.